seems like when you don't have consensus on an issue, then you vote on it. So I think we probably ideally look for consensus, and if we can't find consensus on something that's important to people, then we do a vote. Does that sound reasonable?
Sure.
And we have a number of topics up there. There is a traditional way that facilitators whittle down topics to a manageable level for discussion, which I listed here on the agenda. It's what I wrote was each participant can suggest one, 2, or 3 healthcare topics, which are then listed on the large flip sheets. The topics are then prioritized by having each participant rank his or her 3 favored topics, writing 1, 2, or 3 after the topic selected. The topic with the most 1s will be the topic of highest interest to the group. The topic with the most 2s will be the topic of second highest interest to the group, and the topic with the most 3s will be the 3rd ranked topic. And we may not have all of the topics up there that we would like to see up there. We can include other suggestions from the Obama position paper or from the 2004 healthcare plans. If people think that's a useful way to whittle down our process, we can do that. Or if somebody has a better idea, you can suggest that as well.
Well, the one thing I'd say is somebody else's 2 and my 1. I mean, in other words, to only count 2s and consider that for 2s seems a little odd. I think what you could say is everything that doesn't get any votes, you leave them aside, and then the item that gets the smallest number of points, the most 1s and 2s, becomes the top priority. The second smallest number of points, the 1s, 2s, and 3s, it just, instead of just saying the 1s and the 2s and the 3s, you know what I'm saying?
Yeah.
Okay.
But we would select 3 topics if we did that method.
3 topics based on the lowest rank of given points.
Right.
The other thing is, I'm thinking, again...
It's an arbitrary way to do it, but sometimes it works pretty well.
And I'm thinking we might want to, in a sense, endorse Obama's statements and focus on what we think is missing.
Right, that's another method that we can do.
I have no problem with this plan. I think it's great.
I mean, there's a lot of things we have here that either contradict it slightly or that elaborate it substantially.
All right.
So we could still...
Should we just go through this and decide which items are supplement a point that he's
the most
already made,
supplemental,
and list all those things that contradict him, but what we want in a platform.
Mm-hmm.
Our focus will be just to improve the platform by adding and subtracting things to Obama's plan. It would be useful if we had it as a plan in big letters there too, but everybody has a copy at least of the summary? Mm-hmm. Oh, you all have copies of the total plan as well.
I mean, almost everything we've listed nests under something in his agenda list.
Mm-hmm.
The one that doesn't is that everyone has to have health insurance. That is not in his document and has not been part of his position. I think, now there's a lot of these that he doesn't mention specifically, but he talks, for example, about paying enormous attention to workforce development. We have some ideas, but I don't think there's anything here that contradicts his plan except the one about everybody in the same healthcare system, everyone insured.
Where is
maybe, it's the one over on the first page you get to the right. Oh, no, I guess it's the second page. All the way to the right. Everyone has health insurance, similar standard. About 2/3 of the way down. Right? Endorse Ds. So that's a bit of a contradiction with
All right.
this, but I'm not sure anything else really is.
Does everybody agree that should go in?
Definitely.
My personal thought on that is, I have a conditional acceptance of that. In order for me to agree that everyone should have health insurance, that I want to be a part of it, namely supporting it financially, is that, and just glancing over Obama's plan, I don't see a real big gold star highlight on wellness and prevention and people taking personal responsibility for their own health. Personally, I'm kind of a health nut, workout freak. I eat healthy. I exercise a lot, and someone who's has obesity-related diabetes and smokes and drinks a case of beer every day is and I in a past life was kind of on my way to that, but what I'm saying is I don't want to be responsible for
But you are going to
chronic
be.
health problems.
You are going to be, because that person will get into the emergency room and you are going to pay for it a lot more, 10 times more than you would have.
But what I'm saying is, but my concern, before I'm saying, everybody has to have health insurance, my concern is how are we going to get these people to buy into their own health?
Well, with
And make the
emphasis-
changes themselves.
the
You can give them all the insurance in the world, but unless they make up their minds to change their own
That's where the
lives.
primary
Yeah.
care physicians
Yeah.
come in.
That's where the
It's-
prevention
Yeah.
plank comes in. We can afford to cover everybody if we also have a very high quality prevention effort and education. And I wouldn't mind seeing tobacco or smoking banned nationwide.
I wouldn't mind it either, but then again, I don't want to live in a country where the government says you
I
can't
know.
smoke, you can only make this much money.
The government in
You-
France did.
Yeah,
Well,
they do that in
You know,
other,
in Ireland-
other countries that really care about
I
healthcare.
don't like government a whole
I
lot.
think that part of the problem is, I don't know if there's, someone has an idea that if we insure everybody, that the reason that people stop drinking or smoking because they can't get insurance, that doesn't happen.
No, not at all.
So giving them insurance will not necessarily change whether, it's not gonna encourage people to drink and smoke.
Yeah, but if
So
if
I
they
don't-
visit you, you can tell them and you can show the charts to them. Oh, your cholesterol,
Right.
your blood pressure, you're gonna die in 5 years if you don't stop. And that's what's happening in other countries. I mean, that's why they can bring down those numbers, because they have regular visits, primary care, preventative, and it works. I mean,
A
it's,
lot of people stop smoking because of education campaigns
Yeah.
and the new medications like the Nicorette or whatever you call it. And the same thing could be done with overconsumption of alcohol. And what happens is that these kinds of addictions or practices are just simply become less socially acceptable. And so people don't smoke and they don't drink as much because it's not socially acceptable anymore.
And I like the analogy of comparing a universal health care the same way we look at police services or fire services. It doesn't mean that I don't want them. I don't want to say you can't use my tax dollars to for the police force, because in my neighborhood they hardly ever show up. There is no violence or anything like that. And the same thing with fire. So we have to accept it as something that's needed universally, and at the same time, like Susan said, educating people.
Right,
so that
get
they
them to
could
stop burning their own